Kristen Lewanit coming to you from River Valley Chiropractic, where we teach you to move well so that you can live well. And today I wanted to continue on a previous video that we had published where we were stretching for Iliopsoas syndrome. So specifically targeting the psoas muscle and the iliacus muscle. And we've gotten so much great feedback on those stretches. The stretches we were doing was the supine knee to chest with a bridge variation. And you can catch that in another video. We'll go ahead and tag it in the end of this video so that you can find that one. But the feedback from our runners and our athletes have been really great on getting the psoas spasm to release and helping with their low back pain, their sacral pain, as well as pain that's wrapping around the front, sometimes here in the pocket area, sometimes down the back of the leg, type pain that's caused from the psoas spasming. So I wanted to follow up with an additional stretch that's great for anybody who is experiencing psoas spasm. And remember, psoas is that deep back muscle, that deep muscle in the low back, and Iliopsoas syndrome can cause all kinds of problems with low back pain, hip pain, thigh pain, even pain down the back of the leg into the knee, and sometimes is misdiagnosed as another condition, or sometimes even, we'll be seeing patients in here as in our office as chiropractors, and we're continuing to do the low back adjustment on them, but yet the low back pain is continuing or it's not getting a lot better. And so when we start to work on the psoas muscle and reduce the spasm in the psoas muscle and the iliacus muscle, we find that we actually start to see them start to improve by leaps and bounds. So first of all, thank you to everybody for the feedback. And now we're going to move on to a third stretch for Iliopsoas syndrome. It's a low lunge, and then it has a optional side bend in it as well. And so I'm going to go ahead and demonstrate that here. So what you're going to do is you're going to go ahead and get into a low lunge position. I'll get back here a little bit so you can see. You don't want your knee coming out over your toe. You want it to be nice and lined up in front of your toe. And then you can see my back knee is flat on the floor. For people that have knee problems or knee pain, you can go ahead and stick a blanket or something under the knee just to keep the patella, the kneecap, from being irritated. So in this case, we're stretching the right psoas. I'm also using a yoga block, but you can also just use your hand on your thigh if you can reach down far enough. But the yoga block provides a little bit more, just a surface to put your hand on. So what you're going to be doing for a count of 3, I'm going to be pressing back on the yoga block as my thigh is pressing forward. So it's almost like I'm trying to scooch my knee forward on the floor, but I'm not letting it move. So I'm resisting the forward movement of my thigh while pressing back on the yoga block. So for a count of 3. And then after a count of 3, you're going to go ahead and relax that. And then the optional side bend that you can then add in is staying in this position. You can bring your arm up by your ear and lean the direction towards your front leg. So getting a side bend in this part right there. Now, if this is not enough of a stretch for you and you need more of a stretch, you can make your lunge deeper. You can take your back knee further back. So again, I'm keeping my front knee aligned, moving my back knee further back, and then again, using that yoga block and doing that pressure or that resistance, pressing into the yoga block as you press back for a count of 3. Or 3 breaths. If 3 is too fast, you can do 3 deep breaths as you press, and then relax. And then again, put in that optional side bend. I also like to drop my opposite arm down beside my leg. Just let it come down while I go into my side bend. And then you're going to go ahead and you're going to repeat that on the other side. The exact same sequence. I would switch legs, align my knee, use the yoga block, and press 1, 2, 3. And then you would see my side bend go this way. Okay, so that's a third stretch that you can utilize for Iliopsoas syndrome, psoas spasm, tightness in the psoas, tightness in the iliacus. that's causing low back pain, hip pain, anterior front thigh pain, back of your thigh pain, even down into the knee pain. For my athletes or for anybody out there that is experiencing that kind of tightness, this stretch is the next progression past the previous video in which we talked about the supine knee to chest and the bridge variation of the supine knee to chest stretches. So you would start with those two, and then this would be your third stretch in that progression. If you have any questions about this stretch or any other stretches that we've covered, go ahead and pop that in the comments below. If there's something in particular that you would like to see us do a video on, go ahead and pop that in the videos below, or in the comments below. I'd like to go ahead and thank you for joining me today. If you have not yet subscribed to our channel, go ahead and click that subscribe button. And as you subscribe, there's also a bell notification button. Go ahead and click that on, and that way you'll get alerts when we have new videos come out here in the future. And you probably know somebody who is experiencing chronic low back pain, maybe spasm in those low back muscles, or as a runner, they're experiencing low back pain or sacrum, tailbone pain. Go ahead and share this video with them. Help them out as well. Share the wealth, share the stretches. We do this for you guys. We want to help you out. And personally, myself, I am a runner. I work out a lot, and I utilize these stretches weekly on a regular basis to just, as a preventative measure so that my psoas doesn't go into spasm and I don't have that low back tightness and pain. Again, thank you so much for joining us. I'm Dr. Kirsten Lewanig. We are teaching you how to move well so that you can live well and get out and do those activities that you love to do. Thanks again. Have a great day. Bye-bye.